This presentation will provide an overview of cancer to address the focus question, what are the priority issues for improving Australia's health? The syllabus suggests that you must learn about cancer as well as CVD and one other condition. You must learn about the nature of the problem, the extent of the problem, trends, plus risk and protective factors, the socio-cultural, socio-economic, environmental determinants, and of course the groups at risk. The nature of the problem. Cancer can be defined as abnormal cells that divide without control and can invade nearby tissues. Cancer cells can also spread or metastasize to other parts of the body through the blood and the lymph systems, and it is also known as malignancy. Cancer can affect the body in two ways. Tumour cells grow in the body and they can either be benign or malignant. Benign tumour cells grow locally and do not spread or invade other parts of the body. Malignant tumours, on the other hand, invade neighbouring tissues, enter blood vessels, and metastasize to different sites. What is metastasis? When a cancer cell invades surrounding tissues and vessels, it breaks away from the body tissue and is able to enter the circulatory system. It can then travel to other parts of the body and reinvade and grow at a new location. Carcinogens are substances that cause cancer in the body. Some common carcinogens are tobacco, alcohol, asbestos, and ultraviolet radiation. There are a few main types of cancers. Cancer can be classified according to the way it affects the body. Carcinomas are a more common form of cancer in the body, and they include cancers such as cancer of the lung, breast cancer, colon cancer or colorectal cancer, bladder cancer, and prostate cancer. Leukemias are cancers that affect the bloodstream, lymphomas affect the lymph nodes, and sarcomas affect the connective tissue in the body, such as fat, bone, and muscle. Carcinomas are cancers that begin in the skin or in the tissues that line or cover the internal organs. Some examples of those types of cancers are skin cancer, breast cancer, and lung cancer. These cancers are significant for your syllabus. You need to learn these cancers in depth. Sarcomas are cancers that begin in the bone, cartilage, fat, muscle, blood vessels, or other connective or supportive tissues. Leukemia is a cancer that starts in the blood-forming tissue, such as bone marrow, and causes large numbers of abnormal cells to be produced and enter the blood. Lymphomas are cancers that affect the lymphatic system. Lymphomas arise when developing lymphocytes, a type of white blood cell, undergo a malignant change and multiply in an uncontrolled way. Over time, lymphoma cells replace normal lymphocytes, weakening the immune system. Myeloma occurs when plasma cells grow abnormally and become myeloma cells. Myeloma cells build up in the bone marrow and form tumours in one or many bones of the body. Central nervous system cancers are cancers that begin in the tissues of the brain and spinal cord. Now, there are various general risk factors for cancer. The biomedical factors are considered the more genetic or inherited characteristics that lead to cancer. And these include genetic susceptibility and also hormonal factors, particularly in females. The lifestyle factors are the preventable factors, and they include smoking, alcohol consumption, physical activity and obesity, chronic infections and diet, and then of course environmental factors such as sunlight, radiation, occupational exposure and pollution, which people have some control over. Specific cancers that you will learn about as part of HSC PDHPE are skin cancer, breast cancer and lung cancer. In this presentation, I'll provide you with a brief overview of the extent of the problem. However, you are encouraged to have a look at the Australia's Health document, which is published every 2 years. This provides up-to-date statistics about cancer. You can also check out the Cancer in Australia overview, which is also published every 2 years. Cancer is a major cause of illness in Australia and has a major impact on individuals, families, and the healthcare system. Cancer has long been the second biggest cause of death in Australia behind cardiovascular disease and remains so today. However, mortality rates have decreased steadily over time since the mid-1980s. Survival for cancer has improved over time. People living in Australia diagnosed with cancer generally have better survival prospects compared with people that live in other countries. This is due to improved screening, such as breast, cervical and colorectal screening, improved education and knowledge of the protective factors, and new technology and surgical procedures. Further challenges remain, however. 1 in 2 Australians will develop cancer and 1 in 5 will die from it before the age of 85. So age is a big predictor of the development of cancer. Males are more likely to be diagnosed with cancer than females, and by age 85, males are 23% more likely to be diagnosed with cancer and 25% more likely to have died of it. More closely, 1 in 3 women are diagnosed with cancer before the age of 85, and this is compared to 1 in 2 men diagnosed before the age of 85. There are significantly higher rates of mortality for Aboriginal and Torres Strait Islander peoples, rural and remote communities, and people from low SES backgrounds. In 2014, the most commonly diagnosed cancers include prostate cancer in males, colorectal cancer or bowel cancer, followed by breast cancer in females, melanoma, which of course is a form of skin cancer, and lung cancer. These are the most commonly diagnosed cancers. However, when it comes to causes of death, lung cancer is the most common cause of cancer death, followed by colorectal or bowel cancer, prostate cancer and breast cancer coming in at 7%, and pancreatic cancer at 6%. Alcohol and smoking are the most important risk factors for cancer, and they are highly preventable. And there are 1 in 10 hospitalizations for cancer-related illness in 2012-13. With 30% of cancers being preventable and alcohol and tobacco being 2 major risk factors that lead to many cancers, the 5 pillars of prevention are very important for people to follow to reduce their risk of cancer. Number 1, quit smoking. Number 2, protect your skin from the sun. Number 3, maintain a healthy weight and diet. Number 4, maintain a regular exercise plan. And number 5, reduce your alcohol intake. The cancer incidence, mortality and survival rates have shown some change since 1982. Mortality has declined gradually since 1982 up to this point, but the incidence has shown a gradual increase. This may be due to an aging population, more people developing cancer as people age, but also new screening techniques have helped detect more cancers, so that may have played a role in the increase. The survival rate has also increased, probably due to the fact that we have greater surgical treatments and earlier detection has allowed cancers to be treated more quickly and more efficiently.